If you would state your name for the record, who you're with, and you may begin your...
Thank you, Madam Chair. I'm Ware Wendell. I'm the Executive Director of Texas Watch in strong support of this legislation. Madam Chair, I remember around this time last session, we were working on a number of very consequential patient safety bills in this committee, and you've got another one coming over from the House, a strong bipartisan bill here. As Senator Blanco said, this bill would follow sunset recommendations by making sure that public members are on this public-facing panel. The work of the Texas Medical Disclosure Panel is to give patients the language that they need to make informed decisions about their care. And this will improve informed consent. We trace informed consent back to the Nuremberg Code of 1947, which really focused on having sufficient knowledge and comprehension to make what they called an understanding and enlightened decision. And that's what this will do. The Texas Medical Board has a composition of 12 physicians and seven public members. Here we would have 7 physicians, 3 members from the public, and 3 attorneys. And those attorneys would be across a range of practice areas as well. So it's very good legislation that I feel is going to save lives, because patients will have better questions that they can ask about potential risks and complications of procedures. And I'm happy to take any questions.
We'll hear from the next panelist, then we'll ask questions. If you would state your name for the record, who you're with, and your position on the bill, and you may begin your testimony.
Good morning. My name is Lisa McGiffert, and I'm the board chair of the Patient Safety Action Network. We're a national coalition of volunteer patient advocates working to end medical harm. I've been a patient and consumer advocate for over 30 years, and I'm here in support of House Bill 923 by Senator Blanco. This bill, as Ware said, is about informed consent. It's probably one of the most important interactions that patients have with their health care provider, and I'm sure everyone in this room has had experience about this, and it's really important to get full information. We're asking today to have public members on this committee, not just doctors and not just lawyers, and we want those public members to be knowledgeable advocates for patients, but that's up to the person who appoints them. But as Ware said, this is a well-known practice in Texas to have public members who are voting and contribute fully to the committee deliberations. It's really important for the conversations between doctors and patients to be meaningful and to have information about the specific procedure, the risks of that procedure, and research shows that sometimes that information is not clearly understood by patients. There's been some surveys about that. So as patient safety advocates, we know that one of the biggest things is communication between doctors and patients. This bill had an amendment added in the House that raises some concerns. It requires that the majority physician members have to be present before any decisions be made by the committee, and we're a little concerned that that could impede their work and sort of negate the participation of the other members. So I'd be happy to answer questions about that or the bill. Thank you.
Members' questions? Senator Hall? And while Senator Hall's asking his questions, I'd like Libby Elliott, Deputy Commissioner of Policies and Rules, if you'd come forward as a resource witness. Senator Hall, you're recognized.
I recognize your concern there, but you know, like a coin, there's another side to it. And by having that majority requirement, it would prevent a small group of the members getting together and making decisions, knowing that they couldn't get that decision made if they had others there. And so I think there's a good reason for having a majority there to make sure that we don't have a small group that gets together and makes decisions that otherwise would not have been made.
Thank you for that question. There's a good majority of physicians on the committee, and if they show up and do their work, then that's not going to be become an issue. I would say that the Texas Medical Board has a similar mix, and the public representatives have full voting rights, and there aren't issues that come up in that venue, and they make much more, I would say, patient safety oriented decisions than this panel might. FDA has committees that have full participation of public members, so this is not something new, especially in Texas.
Okay. And I understand what you're saying, but I just say our concern about the Texas Medical Board is just as big as this other board of small group making a decision that the larger group would not. So anyway, but thanks for your.
Thank you.
What say you two?
I would say that there is specific language in the bill that addresses scope of practice because that was raised, but these.
Yeah, and let me just say this. Scope of practice, as Senator Blanco knows, is always an interesting fight, not always a pretty fight, and it's moving someone's cheese. That's really what it is. Sometimes it's to serve patients better. Sometimes, I mean, we had a scope of practice bill last session with the dentist and dental hygienist that finally was agreed upon. And we, moved the needle on it late in the session, but we moved the needle. I just don't think that any board that is not elected should be entering into those conversations that I think are left to the legislative body. Right. So, because we are accountable to the people, right? We make decisions here, and then we're judged by the constituents when we go home. So what do y'all say to that?
I think the language in Section 3 is very definitive, as it should be. Just for the record, I'll read it. The panel is not authorized to take any action that changes the scope of practice authority of any physician or healthcare provider. I think that language is as tight as it can be, and I agree, scope of practice should be left to this body, not to an unelected body. But really the main thrust of this bill is to make sure that we have public members so that we're in compliance with those sunset recommendations, which are across the board recommendations to have public membership that's meaningful. They recommend at least a third of the members, and here we're just asking for 3 public members.
Members, any other questions? Thank y'all so much. If you'd get some information, that'd be great.
Yes, ma'am.
That is all that we have to testify.